Hi everyone, my name is Maria Irigori, and this is my journal club presentation. The name of the article is If You Don't Ask, I'm Not Going to Tell You, using CBPR to inform pregnancy intention screening processes for Black and Latino women in primary care. The outline of my presentation starts with the reason I chose this article, the health disparities amongst Black and Latino women, the problem at hand, the aims, goals of the article, methods, results, conclusion, assessment, CBPR principles, and the questions I have for my classmates. Now, the reason I chose this article, first, I identify as a Latino woman. I am a child of immigrant parents, so I understand what a language barrier is and what its effect on personal health are. Also, I have an interest in intervening within this population, moving further in my career. Now, for the health disparities amongst Black and Latino women and the problem at hand. Women of color and of low socioeconomic status are the population most likely to experience an unwanted or untimed pregnancy than any other childbearing population in the US. Latina and Black women have shown to experience coercion or being persuaded enough to feel forced or threatened during contraceptive counseling. Now, for the problem at hand in the article was that researchers felt that there was a gap in patient-centered care amongst pregnancy intention screening process. And what they wanted to do is to give recommendations to providers according to what Black and Latino women testified. Now, for the aims and the goals of the article, to identify issues women have with pregnancy intention screening with their primary care provider according to their own experience, provide interpretive recommendations to providers in order to ensure a more successful pregnancy intention process, to identify target subgroups amongst Latina and Black women. Now for the methods. In this study, 30 women aged between 15 and 49, which are considered the childbearing years, who are patients at the Ryan Health Women and Children's Clinic in New York City, participated. This clinic is a federal qualified health clinic. Roboxnet was given, and a $25 gift card was given for participating. Patients were interviewed by a community advisory board member about their experiences with providers regarding pregnancy intention screening. This included their feelings, their emotions, their pregnancy history, health history, the provider's characteristics, and who initiated the conversation regarding pregnancy intention. After the interview went on, the transcripts of the actual interview were coded, and 3 important themes were discovered within the coded transcripts. The 3 themes that were highlighted were agency or perceived control, judgment and shame, expertise, and authority. Now, for the first theme, agency or perceived control, what that means is the control that a patient feels they have with their own personal health and their intentions with pregnancy or lack thereof. And the second one is the judgment and shame that they felt. And this was especially prevalent amongst young adolescent mothers, as well as for victims of intimate partner violence. They were especially seen to have been feeling shame and judgment from their providers. Now, for the third theme is expertise versus authority. And what that means is that there were patients who either saw their providers as experts of their own health and what they perceived to be the best um, course of action for them regarding their pregnancy, or if they saw the provider as an authoritative figure and more of a parental figure, more of someone who was kind of just telling them what to do. Um, and so, with that, what researchers did is they gathered recommendations on approaches that were given specified to those themes and in order to improve the process of pregnancy intention. Now, the results were there were barriers identified of having open conversation between victims of intimate partner violence and of early childbearing patients, those directly or indirectly. So, what that means is either they had children early, or someone they know, or a family member had a child early on in life. So, these people, they did not feel comfortable having open conversations or initiating the conversation with the providers. Um, and another result was that there were relationships that showed between each theme um, and what the feelings of patients towards pregnancy intention meant. So, for example, if someone felt like they had low agency or perceived control, and they also felt like their provider was an authoritative figure, they were unlikely to initiate the PI conversation. Now, what was concluded from this study was that FQHC, or Federal Qualified Health Centers, was already the FQHC, I'm sorry, FQHC that was already used had already pregnancy intention screening implemented. Therefore, the study was experience based. So, none of the results were theoretical. It was all from actual experiences of the patients. Now, another conclusion was that there were diverse interviewing techniques involved. There were several interviewers, and they all have their own techniques and their own ways of interviewing. So, that is a factor that was to be considered in the response patterns of the patients. Now, authors, what they stated in their conclusion is for future studies that they should examine experiences with the Community Advisory Board recommendations, especially victims of intimate partner violence and young mothers, which is seen as the target subgroup. And another thing that's important to highlight is that these outcomes go beyond pregnancy intention screening. So these feelings that that these patients have been feeling, they should be implemented in other aspects of provider intervention, not just pregnancy intention screening. And another conclusion that the researchers thought would be useful is to provide a workshop for providers to share their experiences and what works with pregnancy intention screening. And for my assessment, what I found to be a strength in the article was the partnership involvement with the Community Advisory Board and the way that they were able to research and come up with the interventions as well as the coders that were used for the transcripts. Um, and also, another strength is that this is a great concept with great potential. But unfortunately, I do think that a weakness is that it was a very small population. It was only 30 women. And being only 30 women, I feel like it's hard to really rely on this study. Moving further, another weakness is that there was no follow up. Had there been a follow up in the patients and see what their feelings and thoughts were and how the relationship and rapport uh, became to be with their providers, I feel like would have gotten stronger results that way. And another weakness is that I do believe that the assumptions um, or of the actual themes of the way that patients were feeling based off of coded transcripts was a little oversimplified. I felt like they could have definitely been dug deeper and really identified, um, maybe with a follow up interview, with what they had testified before meant, or something like that, not just of a coded transcript. My concerns of this study was the participants' long term effect. And what I mean by that is what what interventions are really going to work for these patients. Are they really going to be able to see a change in the pattern that they have with their providers? um, yeah, so is this going to be an effective intervention with the relationship they have with their providers? And for the CBPR principles that I believe were in this article is principle one, it recognizes the community as a unit of identity. It definitely does that. It does identify the Black and Latino women community as a unit of identity. Principle two, it builds on strengths and resources within the community. And it definitely does use resources as it used that clinic, the federal clinic. Um, and principle five is balances knowledge and action for the mutual benefit of all partners. So I definitely believe that. I feel like they all individually used their own knowledges and brought it all together and gathered all the information they did and brought about this article. Um, Let me see. And for Principle 6, they addressed locally relevant health problems and considered multiple determinants of health and disease. I feel like they did that effectively. Definitely, um, that is a very relevant problem amongst Black and Latino women. Even though it was just amongst 30 women, I believe it is an issue within that community. So I feel like if this article were to expand, if this experiment were to expand to a larger population, I feel like it could be really beneficial, definitely. Now, for the questions for my classmates. Number one, do you think the findings of this study would be useful to implement into other communities besides the Black and Latino community? Two, do you agree with pregnancy intention screening to be necessary amongst childbearing persons with their primary care provider? Three, is there another CBPR principle that could be identified within the study that was not already? Thank you so much, and I look forward to sharing with you guys and discussing. Bye.